Good morning. I'm Mabel Jung, and you're watching the World Healthcare Congress Interview Zone, and I'm very pleased to have with me Dr. Roger Merrill, who is Chief Medical Officer at Perdue Farms. Dr. Merrill, great to see you.
Thanks. Wonderful to be here.
Well, let's start off first by Perdue Farms' message on health to employees and as an employer.
Right. So our target, our bogey, is maximizing human health. The target is not keeping costs as low as they can, or doing the most number of procedures or the least number of procedures. It's maximizing health, and everything we do points toward that. So we have built on-site medical clinics at virtually all of our major facilities. We have a health and wellness programs, won a number of national awards. We have a generic prescribing program, but all these things all aim in the same direction, that is maximize human health.
So does life at Perdue on this front change at all with things that are going on in the general healthcare environment?
Well, it's interesting you ask that. Most of the features of the ACA, the Accountability Act, most of those features that improve health we've already done. So we had already covered all screening procedures. We already covered childhood immunizations at 100%. We already did most of the things that touch the lives of our folks. We had already done. So there's not really much impact of the ACA at this moment on Perdue. There may be some cost increases over time. Due to some of the reform activities. But the essence, as it touches the life of our associates and their families, there really hasn't been much effect because we'd already done those things that made
makes sense. So when people hear about what you're doing at Perdue, is it very hard to emulate elsewhere? Or, well, you've been doing it for so long there, but what are some basic things that are in place that other organizations may benefit from also putting in their systems?
So we never claim that we are the answer for all folks. What we do say is we've built something in the 25 magnificent and unforgettable years that I've been at Perdue. We've built a bunch of things that work well for our population.
Such as?
If they work for the population, so for example, the on-site medical facilities, what we do at those places is three things. We do primary care. So there's a primary care crisis in the United States, not if you work for Perdue, because there's primary care delivered at the work site. So you can step into a clinic on the clock and have your primary care needs met. And that's most of the needs that most of us have, is primary care. Our health and wellness program operates out of our on-site medical facilities, which incidentally are named wellness centers. They were named by a chicken guy, not a doctor, because no doctor is smart enough to call it that. A chicken guy said, we'll name it a wellness center because that's the product. The product is well associates, and he was absolutely right. A doctor would have named it a clinic or a sickness center. A chicken guy says, I'm more interested in having well folks than treating illness.
Right. Amazing what just a change in a word does in terms of perception. Right. Now, what about healthcare supply chain? Do you have any concerns about that?
Okay, well, we have lots of concerns, and this fits in really with our view of the value chain or value scale. So we define value in health the same as the Institute of Medicine does, which is value equals health delivered per dollar spent. So health, again, is the target. And if we look at all the things we pay for in the $3 trillion that we spend on medical care in the United States, we spend a whole lot of money on things that don't deliver health. For example, the least efficient place to spend our health dollars are in intensive care units. So lots of money, not much health conveyed. Now, I understand if you get run over by a truck, that's probably where you need to be. But it's nonetheless the value, the health conveyed per dollar spent, very low in intensive care unit. The next least valuable thing is hospital bed days. A hospital is the most dangerous place on earth. We've heard this morning that you're more likely to die in a hospital than on the deck of an aircraft carrier. So it's a dangerous place to be. Next would be medical specialist office or perhaps some ancillary services. And as we percolate up the value chain to things that are most valuable, primary care is highly valuable. That's why we deliver them in our on-site clinics. And health and wellness today we see as the peak, as the top of the zenith of how we can deliver health per dollar spent for a rigorously designed, now all wellness programs are not alike, but a rigorously designed and measured wellness program delivers health at a level that no intensive care unit ever can.
Okay. What about things that are happening outside Perdue, changes in health plans, moving more from a wholesale market to a retail market where consumers can shop around for their choices? Does that affect you at all? I mean, how do you finance your health care?
Right. So we're self-insured, and in many parts self-administered. We have found that if there's something that we can do, we generally can do it better than what someone else we hire. Now we have some important strategic partners that help us with many of these things. What we have not done is to abrogate our responsibility and hand it off to our associates. We think that it's not fair to say to a production line poultry worker that because we have not been able to find a solution, we are going to hand it off to them in the hopes that they will find a solution to the mess that the U.S. healthcare delivery system is in at present.
Right. Okay. Well, Dr. Merrill, I really appreciate your time, and I've enjoyed learning about the Perdue story. And thank you so much for your time today, Dr. Merrill.
Thank you, Ms. Young.
And I'm Mabel Jung. Thanks for watching.